interpreting your results.
Okay.
So there's a different reference range for your rest and that of your but we prefer the arm because that is at the level of the heart.
Okay, so let me quickly announce the phone lines. You know, we're live and interactive. We're on WhatsApp on 05939329993, 05939329993. That's the WhatsApp line. You can send your question in as a text or as a voice note, 05939329993. And then you can ask whatever is bothering you, whatever question you want to ask, just like someone has sent in. So, you know, just like I was saying, so she wants to know what is the right time to check your blood pressure and how many times must I check it for me to know that there's a problem, that I have a problem.
So you should have had enough rest. I mean, you should have rested. So not after an activity, right after an activity. Your blood pressure will go up if it's right after an activity.
Okay.
So you have to sit down, have a rest, then you can check your blood pressure. And then you can check it 3 times. At least 3 times, yes.
Okay.
Then that would give you a fair idea, the range of where your blood pressure is. Yes. So
Okay.
I would say you have to rest. So, I mean, if it's early in the morning or even if you've moved about, you have to sit down, rest, maybe some 30 minutes, an hour. Then now you can check your blood pressure. Then you can check it 3 times, and then you would see the value that is most consistent. Yes.
Okay. So when you check it, you must most obviously write it down somewhere.
Yes.
And what she's asking is how many times should it be high for her to walk into hospital? So if I'm new to checking blood pressures, right? What are the numbers, okay, that I should see and go like, oh, this is okay. I should see and go like, oh no, this is really bad.
So a BP consistently more than, so the top part is called the systolic, and the bottom part is the diastolic.
Okay.
So a BP with it being more than 140/90, consistently more than 140/90.
Okay.
It's best you visit the hospital,
Okay.
just tell your doctor, and then let's decide on what we have to do for you, what tests we have to run for you, and then let you know if you have to do maybe more home BP monitoring for us to decide that you have to be on a medication or you have to undergo lifestyle modifications for this consistently high BP.
So the top one being
140.
consistently 140 or higher.
Higher, yes.
And then the down one being 90 or higher.
Yes.
You should, at that point in time, decide, let me walk in and see someone. And I like it when patients come in, like they've actually been documenting, like they've been writing it down. So you see that, oh, okay, like there's a pattern. So let me take this message from Charles. Charles is saying that he noticed 2 things about his BP. He's saying that when he's stressed out, his blood pressure, he notices, goes up. Is that the same as being hypertensive?
Okay, so blood pressure is controlled in the body by a certain system, and depending on your current state in terms of whether you're anxious, you are exercising, we are resting, and all of that, the body will decide on a certain blood pressure range. So we say people are hypertensive if consistently their blood pressure is high, and that's when we are convinced that you're hypertensive. But during stresses, there are certain things that change in your body that would increase your blood pressure as a way of sort of helping you.
Okay.
If it's just for that time being, then it's not a problem. But if it remains after the stress has been taken off, or all the time your blood pressure is high, then that becomes detrimental. So in that case, it has to be looked at. So just checking your blood pressure once, at the time you're anxious, your blood pressure is high, may not be a problem, but it has to be monitored. And as he rightly mentioned, you need to take that time when you are relaxed. Relax, that's the best time.
That's the best time.
Yeah. And yeah, so at times it becomes very difficult to tell, because somebody says, anytime I'm checking my blood pressure, I'm anxious.
Yes.
So anytime my blood pressure is up.
Yeah, but
even at home.
people come to us, tell you show them their reading, they're like, no, it's you know, it's because when I get here and they're checking it, I'm just scared or anxious, and that's why it's high.
So for those people, at times what we request for ambulatory blood pressure monitoring. So
Okay.
that is a device, the same blood pressure that's modified to take your blood pressure automatically.
Okay.
So it can set it to check maybe every hour or every 30 minutes. So it will keep checking.
Okay.
So in that case, one, your body will become used to it, and so you shouldn't be afraid of it. You won't be anxious, and it can also check it when you are asleep. When you are
Okay.
asleep, that one you won't tell us that at that time you were anxious when you are asleep. So
People
in
can
that
be
case,
anxious in their sleep. Oh.
so in that case, it gives us a fair idea because naturally when you sleep, your blood pressure has to drop. Naturally, about 10% drop. If you're unable to achieve that 10% drop when you're asleep, or when your blood pressure is constantly high when you're asleep, that one we can say that you are hypertensive, and it's not because you are anxious. So that's a way that we use. For some people, then when they come to the hospital, it's high, but when they go home, it's fine. And your blood pressure is important because it's what keeps you going. So we look at what has been keeping you going, not what happened at the hospital for just that 5 minutes. So we're interested in what is happening at home, your usual state. How is it? So if you're getting good blood pressures at home, we are okay. So let you monitor and bring it later so that we'll see how that is.
And we're 34 minutes past 8 o'clock here on 107.9 Orange FM. This is the Orange Health Lounge. And you know, every time we eat, foods and sugars are trapped in between our teeth, leading to both tooth decay, gum disease, and in some cases, foul breath. It's good to brush your teeth twice a day, especially in the mornings and at night, with Pepsodent Cavity Fighter. It gives your teeth, better protection, and it makes your teeth 10 times stronger. Pepsodent Cavity Fighter is fortified with pro-fluoride and microcalcium ingredients, sealing tiny and invisible holes in your teeth. This prevents cavities and keeps your teeth strong and your mouth healthy. Pepsodent Cavity Fighter, maximum cavity protection and 10 times stronger teeth. 25 years of education to brush day and night. Pepsodent is recommended by the Ghana Dental Association. Get your Pepsodent at any shop, or you can call their customer service on toll free 0800 2030. Always remember to brush your teeth in the morning and at night before you sleep. Pepsodent, every smile matters. And if you don't know Pepsodent, I don't know where you have been, because we call every toothpaste Pepsodent. So Pepsodent is the right one for you. Now, there's a very interesting question that Eunice is asking me to find out from my guest. She's saying that kindly ask Dr. Mponsa and Dr. Seyao, can a traumatic incident cause me to become hypertensive? Or I may have been hypertensive already, and the traumatic incident may have made it prominent. Has that ever happened? So somebody goes through some trauma, something, and then suddenly post-trauma, every time their blood pressure is through the roof?
So, two ways. One is that it's possible that a person was hypertensive before the incident. But usually when there's an incident and your blood pressure goes up, when that incident is taken off, your blood pressure is expected to come down. Anything that stresses you can make you have a problem with blood pressure regulation. And especially if it's very high. For example, somebody comes to the hospital for whatever reason, blood pressure 200. This person, you won't be able to convince anybody that you didn't have any blood pressure issues. Of course, probably you didn't know, but even if your body is managing stress and it will want to raise the blood pressure, it won't typically, regardless of the stress that is happening. It means that you have a problem with controlling your blood pressure from the beginning. So that person probably was hypertensive before the incident happened. But if your blood pressure is going 150, 160, you are anxious or something is happening, then after everything, it comes down. Then such a person will say that the blood pressure went up because of the stress that your body experienced. But once it's constantly high and extremely high, then in that case, we would say that you might probably have issues with your blood pressure even before the incident happened.
Dr. Sarah, let me find out from you. So, are there any like symptoms for somebody to now say that I think I am hypertensive? Are there any? Because I think for me, one commonest thing will say that, oh, I have this headache that doesn't seem to be going away. But are there any things that should, if someone is listening and, sometimes we're in denial.
Yes, that's true. That's true.
We know we're in denial. Are there any things that should let you decide that, let me come to hospital?
So interestingly, it's a silent killer
Yeah.
in the sense that your blood pressure is high. Your blood pressure can be very high, and then you wouldn't have any symptoms or you won't show anything. So sometimes those that come in with the headache as complaints, most often than not, the BPs have gone way too high, very, very high. That's when you can have that. But we have a whole number of people, a number of people that may come with no symptoms, and then their blood pressures are high. So it's difficult to say that this symptom will let you be aware that you have a high blood pressure. It's a silent killer.
The two of you are in internal medicine. Let me find out. Some people go for screening, and then, they're checking blood pressures, and then the team picks a very high pressure in someone, and then for some reason we start to medicate the people. This morning I want to talk to people who go around doing screening. When you pick somebody who's for the first time has a really high blood pressure, what are they supposed to do? Because I think I attended a workshop recently and there was someone checking the BPs outside the workshop. So I asked, oh, okay, so if you check somebody's BP and it's high, what will you do? She said, oh, they said we should give the person this medicine. It's you. And I was like, all right, nice. So people do health screenings, and now that we're in the political season, people will be doing health screenings left, right, center. If you pick somebody's blood pressure in such a screening, what should you do?
Okay, thank you. So if you pick very high blood pressure, it depends on who is picking it. If you are not a doctor or you're not somebody who is licensed to prescribe medications, I don't think there's any point trying to prescribe. You better refer the patient, that person that you are seeing with high blood pressure, to an appropriate institution. First of all, it may be that the blood pressure may not be high consistently. Maybe that was just an episode. So just starting medications may be a problem. So you have to convince yourself that this blood pressure is consistently high. Refer the person to the hospital for follow-up. But if the person that is screening is a doctor, I'm sure that person would probably know what to do, especially if blood pressure is very, very high. Person is coming for the first time, and you think it's an emergency, and you're a doctor and you want to take action. That would be different. But for non-doctors, it would be good to refer such patients to a hospital for decisions to be taken. First of all, to convince yourself that blood pressure is really high, and to decide on the next appropriate management, because it's not every blood pressure level that will demand medication. Some may demand lifestyle modifications, and some may demand lifestyle plus medications.
The lifestyle modifications, I don't know about you, but yesterday I was talking about it to my Absunians. The lifestyle modification there, it looks like EMFA.
It works. It works. Recently, a 36-year-old lecturer contacted me that consistently his blood pressure has been high. He checked his cholesterol to very high, and then we talked about lifestyle modification. But I think what motivated him was like, I can just imagine my poster being on the wall, 36-year-old lecturer who just finished his PhD.
and there's a poster on the wall.
Yeah. So then he right after that, he just bought skipping rope, boots, and everything. And within like a month or two, all the parameters had reversed. Blood pressure now around 120 something all the time. Cholesterol had come down from 7 point something to 5, just with lifestyle modifications.
Okay.
So it can work at times.
So we're there. So because you can have poor heart health and it may be asymptomatic, I want the two of you to talk to me about lifestyle modifications. Like, what are, what works? Let me be honest. What I know. Good morning to you, Sagato. Sagato, how are you? I hope you slept well. People have joined gym groups on WhatsApp, but they don't even go there. People have bought and downloaded apps to remind them to work out. People have joined Keep Fit. What works? What really, really works?
What works? What works? So that one, I would say, just look at yourself and plan, because you know your schedule. You know when you wake up. If you've joined a gym that starts at, let's say, 7, and you need to be at work at, let's say, 6, then practically that is not possible. So you need to ask yourself, what can I do? But always remember that it's better to do something than nothing. So in that case, you can start gradually. Certain things are very easy to do, like skipping. You can skip even in your bedroom.
Okay.
You can skip everywhere. You don't need any gym to skip. Like walking, you can decide to just be in your house and just be walking around. Time yourself and be walking around. So you don't really need, as in those fancy, if I should call it, methods to change your lifestyle. You just have to have a plan. That is what I want to do. There's my weight. I want to bring it to this level. I just need to cut down on my diet. There's what I'm going to do. I need to exercise 30 minutes every day. So I'll break it down to, let's say, 15 minutes in the morning, 15 minutes in the evening. I have access to gym, so I want to go to the gym. Or I don't have access to the gym because that one, it's not everybody who has access. And even for people who have access, at times you feel like you wouldn't want to go to the gym, and that may be a problem. You can tag it to something. Anytime I'll go to the washroom to bath, before that, I would want to do this amount of exercise. So that even if you get to the washroom and you haven't done it, you have to come back and do it. So it's just a matter of planning, doing what you think you can maintain. So that one is very important. It should be sustainable. Whatever you're doing should be sustainable. So every day you can do and add on with time. So that's what I think.
Yeah.
Just to add on, in instances where we have people that work close by but decide to rather drive, I mean, there are days where you can choose to walk. And then in facilities where they have stairs, but then, I mean, they have also the elevator, you can choose to use the stairs on certain occasions. For those that have kids, you can engage in activities with them. I mean, kids like to run around, play. I mean, they all count. So
It's not easy.
I know, I understand. It's quite difficult, but
it's not easy.
That's going to be an intense activity for you to do. And then
that activity is hard.
Yes, that's true. But then it will all count. So I think that's the little I want to add in terms of the walking and then the activity bits.
A colleague of mine has decided to change where he parks his car. So at Confanachi, we have the doctor's flats also there. He doesn't stay at the doctor's flats, but he deliberately goes to park at the doctor's flats and then walk to the hospital. That will take me about 5 minutes. So in and out, at least he gets 10 minutes of walking every day, even without doing anything. So that's a technique that's
I mean, just park a bit further away from your normal place of work and decide to walk. Just decide to walk. I know sometimes it's it's difficult. It's just difficult to say that I'm walking, and I think I've tried it once. I just didn't like the I said, no, I'm going to walk here, give myself enough time to come and do my show, because I'm always saying people should walk. I'm walking by the show and everybody wants to give you a lift. Everybody's asking you, like, do you need a lift? I'm like, no, I just want to walk. So sometimes, yes, walking is good, but, guys, the lifestyle, I'm not just talking to the men, the women too, that, like, the lifestyle is really, really, really important. Let me share with you some statistics that will blow your mind. Now, good morning to you, Dr. Collins Kokro. It's always good to know you're doing the listening. 85% of cardiovascular deaths, are due to heart attacks and strokes. And 1 in 3 of cardiovascular disease deaths occur prematurely in people under the age of 70. And, we're all trying very, very hard to do the things that would keep our hearts healthy. This includes lifestyle. This includes our diet. This includes things like tobacco use, weight maintenance, and if you have a family history or a family background of people with, or someone in your family with cardiac condition, it can just be hypertension. You should, as a family, you should decide that, what, let's check, because this thing runs in families. Hypertensive, right? 05939329993. That's our WhatsApp line. You can send your text or you can send your WhatsApp. So Gina wants me to find out from you. She's saying that there is deliberate walking, and then there's no, and then there's normal everyday walking. Does the normal everyday walking count as exercise? Like normal, going about their day to day. I'll say exercise. So.
Well, that's what I said. I mean, all the activities, they count. But then the brisk walking will definitely be more, or the more intensity is more, or it's much better compared to the, should I say, walking leisurely. Yes. But at the end, they'll all contribute. But it's just that the other one will contribute a bit more than the other.
Okay, so let's talk to the guys who like a bit of alcohol every now and then. How much? Please, the boys, stop texting me. I beg you. Let me do my show in peace. But let me ask you a question for you. Everybody wants to know how much booze is bad and how much booze is good. Like, how much is too much?
So this alcohol issue is controversial. So we measure typically 14, maximum 21 units a week. When you convert that, let's say about more than 3-4 bottles of that the whole week. And
take more than, let's say, 4 bottles.
Yes, 4 bottles. And even that, to take, let's say, that 12 or 14 units all at a go of alcohol at a point in time. Maybe it's a Friday night, you want to take all your 12 or 14 or whatever units together. That's not how. But really, when you look at alcohol, just by the fact that it's alcohol, that's when we consider the 12 and all of that. But alcohol taking also comes with other lifestyle issues that may together increase your risk. So we realize that in the end, the alcohol may not even be beneficial. The small amount of alcohol that we say may be beneficial, because taking that alcohol will come with other lifestyle issues, like smoking, like taking. People will take alcohol with, let's say, meat, for instance, and all of that. So in the end, it may not be helpful. So the best to do is not to take alcohol at all. That one is better. You don't lose anything by not taking alcohol. But if you have to take, then it should be you have to take, then it should be as minimal as possible.
It should be, please. The caveat is that it's a certain number of units of alcohol per week. Okay, yes. So we're saying mini bottles, not the big bottles. So don't say. The first thing that made me realize that I am hypertensive is that I started to have challenges with my vision. I couldn't see properly, and I thought it was just one of those things until I went to the eye clinic, and then they checked my eye pressure, and they checked my blood pressure, and that was when I knew I was hypertensive. That happens, right?
Yes, that happens, yes. So when you are hypertensive, it can cause damage to these small vessels, and then the eye is supplied by vessels. So when you have high blood pressure and it's very high, you can have a retinopathy. In that instance, you can have blurred vision because of this damage to the small vessels to the eye.
Okay.
Yes, so that's possible. That was this only indication. But that's really for a very long time, and not mainly like acutely. You have the high blood pressure.
Okay.
Yes.
Okay, so it's not going to be something. It's something that should have gone on for quite
Has
some
been long
time.
standing most
Yes,
often.
or the blood pressure is triply
Was-
high.
yes.
In that
Mm,
case, even if it hasn't been on for a very long time, that can also lead to changes in the eye, as is saying.
mm,
So the 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 eye is actually a window to see so many things.
mhm,
So we can, when somebody has diabetes, has hypertension, and all of
mhm,
that, may
mhm,
affect the eyes, as he
mm,
rightly said, because the eye, there are vessels in there, and
mhm.
that one the doctor can easily see those vessels.
Yeah.
And then if there are issues with it, that can be seen.
Hmm.
So hypertension affects
Mhm.
every organ in the body. It can
Mm.
affect the eye, the kidneys, leading to kidney problems. It can affect the brain, leading to strokes.
Mhm.
It can affect our male organs.
Hmm.
So that's also
Hmm.
another thing.
That one
And some
there.
people are worried that when you take blood pressure medications, it will cause erectile dysfunction, so
Mhm.
they won't take. But
Mhm.
hypertension itself can also cause erectile dysfunction, so that can be controlled. And it's not every blood.
Let's tell um, male patients that if I give you this drug, you're not going to have an erection because um, today was Saturday. I had somebody in my clinic on Thursday. I had seen this man about 6 months ago. Started on antihypertensives, because he had right-sided heart failure. Never saw him again till Thursday afternoon. His only complaint is that he can't get an erection. Then we checked his blood pressure and it was like, just like 210, one something. I was like, come on. Definitely your body is not going to send any blood there. Erectile dysfunction. Is that what it is? For all our males who are listening.
So the drugs that the antihypertensive that cause erectile dysfunction, most of the time we don't start patients on those medications. They are more or less like top-up medications.
Mm.
Usually, if somebody's having hypertension, the person goes to the clinic.
Mm-hmm.
The first line of drugs the doctor is likely to give
Mm-hmm.
is a group of drugs that we call calcium channel blockers,
Okay.
and also probably another group called ARB or ACE inhibitors. Those
Mm-hmm.
group of drugs, they don't usually cause significant erectile dysfunction. In
Dysfunction.
fact, the ARBs, they've been shown to even improve erectile dysfunction.
Okay.
So the first 2-3 drugs that doctor will give you,
I'm not going to cause that.
most likely not going to cause any
Mm.
significant erectile dysfunction. However, if there need be and doctor needs to add on and he's giving you a drug that is going to cause erectile dysfunction, he may draw your attention.
Mm.
At times the doctor may not tell you because at times actually just the fact that a person is going to take this drug, person will think that this drug will give you erectile dysfunction, I won't take. But it's not always that. Even those known drugs, it's not always that they cause erectile dysfunction. Some people are on it, no issues.
No issues.
In fact,
Okay.
chances are that you are going to hear the drug causing erectile dysfunction less than you not hear anything at all.
Okay.
At times you ask them and there's no issue.
Okay.
And you need to also weigh the benefits against the risk.
Mm.
So if it's very needed, you have to give it. And for the erectile dysfunction, there are drugs that can help with erectile dysfunction. So if you're on a drug, you get erectile dysfunction, go to your doctor. Your doctor may change it
Mhm.
or probably add a drug to counter that effect so that you'll be okay.
It's 9 a.m. here on Kumasi's Music Leader Orange 107.9 FM. And today we're talking about the heart. I'm speaking with cardiologists from Confanochi Teaching Hospital. And it's a conversation that I think we need to have more. It's a conversation that we need to take, we need to share this conversation more because it appears that many people do not take their health consciously. We don't really care about it until we're at the stage where there's very little that can either be done about it, or we're at the stage where there's a lot that needs to go into making sure that you are fine. So if you're listening to us this morning, find a clinic, find a good hospital, or now many pharmacies have the ability to check blood pressure. So walk in and say, you know what, I just want to check my blood pressure. And I know a lot of the Ghana Health Service facilities have wellness clinics that we're promoting for you to just walk in and then just check your blood pressure. Good morning to you, Adra Yunus, CEO of Manak Beauty Parlor. I hope you've checked your blood pressure. I really hope you've checked your blood pressure. As for you, you should check your blood pressure. Now, Lily wants me to find out from you, saying that she was told that she had high blood pressure when she was pregnant. Now the blood pressure is gone and she's no longer on. Blood pressure doesn't come back.